Thank you so much for inviting me. And I deeply apologize as I did have a hard stop at noon my time. So just giving me about 2 minutes. So I'm not going to be able to share the presentation that I had hoped to share with you today, really focused on kind of MRD and colorectal cancer and efforts that we're taking not only to kind of prevent recurrences in the United States, but globally. So maybe I'll just make a couple of comments on kind of the role of MRD and ctDNA in colorectal cancer and how I think there's a tremendous opportunity to really leverage this technology, not only to potentially bring treatments earlier where we may be able to cure more patients, but to really help facilitate and expedite drug development. So I've been working in this space for, now around 10 years or so. And I think what we have seen over the decade plus is that ctDNA has really emerged across solid tumor malignancies, especially colorectal cancer, as one of the most powerful prognostic biomarkers. So with just shy of, 100% certainty, if you're able to detect minimal residual disease on a patient's or in a patient's blood after curative intent therapy, the cancer is going to recur. And in the United States, there's a tremendous amount of testing that's happening. However, really harnessing the power of that testing that is happening to generate the clinical utility data is greatly needed. So these clinical trials are very hard to do. They can take a long time to identify the patients, yet there remains to be a really tremendous opportunity if we can better figure out how to identify these patients at higher risk and get them onto clinical trials. And when you have such a dynamic biomarker, these clinical trials potentially can really help get a fast readout. So the lead time to recurrence to a time to event, events such as recurrence is short, and you have the blood-based biomarker that you can actually follow dynamically. So we partnered and have now spun off a kind of nonprofit called RER, or Reversing Early Recurrences, which is a spinoff from Science for America. That was a nonprofit that Dr. Eric Lander started, and really are trying to bring together cancer care organizations, not only in the US, but globally, testing companies, biopharma, patient advocates to really think about how we move the needle to kind of bring more curative therapies for colorectal cancer patients. So thank you so much. And I'm happy to answer any questions offline. And my email is aparna.parikh@mgh.harvard.edu. And kind of really, really tremendous effort that's happening here today. And really appreciate the emphasis on global access as well. Thank you.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.